That's Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
Well, we kind of knew numbers would rise in the fall, but it's only October. Where do you see this going based on what we've been seeing with these positivity rates?
Well, this rise was predicted. However, it came early. It came about a month earlier than we thought, and it's bigger than we thought, and it's growing exponentially. That's why you're seeing all these restrictions put in place, because remember, exponential growth. We're having approximately 1,000 deaths per day. What was just predicted by the University of Washington group, triple that amount. I mean, that's really incredible.
Dr. Murphy, we're seeing some stories this morning and over the weekend about these so-called long haulers, sometimes younger patients who didn't show necessarily any symptoms when they had COVID, but are still suffering from new symptoms going forward. What does that research reveal?
Yeah, no, we're learning more about this disease every day. It's being studied really very intensely, as you would imagine. It turns out in these younger adults, these ones, 20 to 50 approximately, that 10% of them, even though they had relatively mild disease of the COVID itself, they're having long-term problems, headaches, fatigue, just some mental, cognitive difficulties that goes out for many, many months. We don't even know how long.
And we talk about the rising numbers and restaurants shutting down, some people defying that. As public policy, how does that work if there are no consequences?
There will be consequences. I mean, there has to be at some particular point.
I mean like civil penalties or something like that. Obviously, the consequences are people may get sick. I didn't mean to imply that.
Yeah, no. But no, there will be some kind of civil penalty. I mean, first, we would like people to all get on the same page and get this thing stopped. Like they did in the UK. They had the rising numbers just like we're having here. They shut everything down. And Boris Johnson, the prime minister, has just said, 28 days may not be enough. We may have to go a few weeks longer. So, we need to really get together with this because the enemy is the virus. The enemy is not each other. We're only trying to get this thing damped down. Do we want this pandemic to triple? Want all the numbers to triple? If that triples, if that mortality rate triples, that means the hospital system in many parts of the country is going to implode, like it did in New York earlier on in this pandemic. We don't want that. That is really just a crisis we can't handle.
Dr. Murphy, looking at New York, the Governor Cuomo there is saying we're not going to do this quarantine list anymore. We're going to require people to get tested as they enter New York. Do you think that's a good idea nationwide?
Yeah, no, I think that's a good idea. It's different from what we've been doing. So in other words, to go into New York, you have to have a test. And then when you get there, you quarantine for 3 days. Then you have another test on day 4. The testing facilities are increasing. They didn't specify what kind of test, so maybe you could have one of those easy tests where you get the results in 15 minutes, but at least some kind of test. I think that's really what's going to happen.
All right, let's get to viewer questions. Are the COVID numbers really as high as being announced? I heard that people who have been taking the COVID test twice are being counted twice, so in turn, it makes our number go higher.
Yeah, well, no. The people who are diagnosed with COVID are only counted once because the labs have to report the name and contact information of the person. So that's just one time. If I go in 3 times for tests, I'm going to be counted as having a test 3 times. Nobody really cares about the negatives. It's a very dynamic situation. Last month when I took the test, it was negative. This month, I've had some contact with somebody accidentally, maybe, who has COVID, so I want to get tested again. That's okay. You need to get tested again. It's dynamic. So don't confuse COVID testing when they're negative and COVID testing when you actually have COVID. They're 2 different things.
Next question. How is an enclosed tent outside better than indoor dining?
Well, tents are pretty drafty. The more you want, the idea is you want fresh air. But if it's really a tight tent, I think it's just as bad as being indoors.
All right, Doctor, thank you. If you have a question for Dr. Murphy, head to our Morning News Facebook page and post it there. We'll talk to him again tomorrow. Thank you, Doctor.
Okay, see you tomorrow.
All righty. 10 minutes after 7, the Bears offense show.